Hi guys, and welcome to this class. And today we are going to be discussing the organs of the what of the respiratory system. So let's start with the nose and the nasal cavity. I'll be right back. Yeah, welcome back. And now let's start with the nose and the nasal cavity. So let's bring the diagram. So as usual. Now, this pointed end is the what? Is the nose. So let's discuss the nose first. We know that to describe an organ, we used to use our acronym DOLS. But the interesting thing about the respiratory system is that they don't possess nearly all these characteristics. So we are safe. So what we actually need to discuss is just the structure. Now, to talk about this nose, you can start by saying it is an organ of the respiratory system. And then it is immensely vascularized. So immensely what? Immensely vascularized, which means it has a high level of what? Of blood supply. And then the important thing here is that the nose is divided into two. So the first one is called the external nose. The external what? The external nose. And the second part is called, can guess it as well, that's the internal nose. Internal nose. And now, what is the external nose and what is the internal nose? So you can just touch your nose, just from behind the camera like that. Touch your nose. So the outer part that you're feeling, so that is not that hard. So is what? It's the external nose. As simple as that. So if you now notice this, you will realize that it is not hard, and that is telling you something. And that is that it is made up of what? It is made up of cartilage. So the external what? The external nose is made up of what? It's made up of cartilage and it's a family of hyaline. So it's made up of hyaline what? Hyaline cartilage. So this external nose is made up of what? Of hyaline cartilage. And that cartilage is called the nasal cartilage. The nasal what? The nasal cartilage. As simple as that. That is all about the external nose. So you can start by saying the external nose is what? Is the outer part of the nose made up of what? Of hyaline cartilage called nasal cartilage. It means the cartilage of the nasal, the nose. As simple as that. And now talking about the what? Talking about this internal nose. The internal nose, where can you find it? Just after this place, continue pressing backward. You realize that you find something hard. So that hard structure is called the internal nose. And because it is hard, that will be telling you something. It is made up of what? Of cartilage, I mean? No, it is hard. So it is made up of bones. And those two bones are called the ethmoid bone and the vomer bone. As simple as that. So the internal nose is made up of bones, which are the what? The ethmoid and the vomer bone. As simple as that. So a quick recap for the external nose. The external nose is an organ of the what? Of the respiratory system. And then it's what? It is divided into two. So we have the internal and the external nose. So the external nose, the pointed end, is made up of hyaline cartilage, which is called the what? The nasal cartilage. And then the internal nose is made up of what? Is made up of bones, called the vomer and the ethmoid bone. As simple as that. Now, let's take a look at some other structures of this nose. Now, if you notice, your nose is divided into two openings. So, this is the nose. So, this is what the nose looks like. So, we have a hole here. This hole is called nostril. Nostril. Or you can also call it near. So, for plural, nostrils or nears. Now, why is this nose divided into two openings? It is divided into two openings due to this structure between them. So, just this structure like this one. So, this very structure. So, it divides the nose into what? Into two openings called the nostrils or nears. And that structure is called the nasal septum. Nasal what? Septum. So, I told you in our class for CVS that whenever you see septum, septum means anything that causes division. So, in the heart, we said it's called the what? The cardiac septum. But at the nose here, it's called the what? The nasal septum. So you have septum in other parts of the body as well. So we're getting there one after the other. For example, we have the septum in the breast, dividing the lobes. So we have the septum in the testes, dividing the lobule as well. So we're talking about them later. So septum means a division or something that forms a what? A partition. So now, apart from that, we said the nose is what? is divided into two nostrils or nares by what? By the nasal septum. And now, those nostrils, those holes, they contains air. They contain what? Air. And the function of those airs is to do what? Is to trap foreign particle. Trap what? Dust. Yes. To trap dust. You can now add and foreign particles. So, to trap dust and what? And foreign particles. So, from entering the nose. So, they are going to trap it from what? From entering the nose. Sometimes, if you work in a dusty environment, once you blow your nose, you realize that you have some kind of mucus, some kind of dust on the mucus. So, that is the function of the air. So, it traps those dust from entering into your, what? Into your airway. So, it filters the air we breathe in. I hope you get that. So, as simple as that. Now, let's talk about this nasal cavity. Now, the next thing is nasal cavity, right? Nasal cavity is just from here, from this region. Oh, sorry. So nasal cavity is from here up to here. So everything in black. So everything in black. So this black, what it encapsulates is what? Is the nasal cavity. As simple as that. Now, this nasal cavity, what I expected to say about it is the definition and its organs in relation. Which means we can start by saying the nasal cavity. Just from the word nasal cavity, you should know the definition. It is the space or the cavity behind the nasal, behind the nose. As simple as that. So you can start by writing that first. That nasal cavity is the what? Is the cavity behind the what? Behind the nose. As simple as that. And now you have to do something tough. That is the organ in relation. Or sorry, the structures in relation rather. So now, in structure and in relation, I told you that majorly you should write about just 4 things. Or you can make it 5 if you wish. So the first 4 is what? Superiorly. Superiorly. The next one is inferiorly. The next one is anteriorly. And the last one is posteriorly. I said if you like, you can add lateral. Now, superiorly, what can you find in relation to it? To the nasal cavity. Now look at the body very well. Take a real look at this now. So, this nasal cavity now, on top of it is this part, this structure. So this structure is the base of the skull. The base of the what? The base of the skull. Now, if you attended my class on the fundamental knowledge of anatomy, so I told you about the cranial cavity. So we said it has a vault and a what? And a base. So, and I told you that the base is just right here. So, on top of the nasal cavity. And that will give you a name to what? To what the base of the skull is made up of. So it is made up of majorly 2 bones. Called the what? The ethmoid and sphenoid bone. And what? And sphenoid bone. So these are the 2 options you can use for superiorly. You can say superiorly to the nasal cavity, we have the what? We have the base of the skull. Or you say what? Or you say the ethmoid and the sphenoid bone. As simple as that. And then you can use the 2. Now, for inferiorly, what can you find? Now, take a look at the diagram back. This is the inferior aspect now. Now, under it, we have this structure. This structure together, they are called the palate. The what? The palate. Now, you open your mouth. So, the first part, if you call D, so where that's your tongue, the tip of your tongue, where it is touching, why calling D, is the hard palate. So, you can't even call the hard palate without using that part. So, hard palate. So, that's your D. So, exactly where the tip of your tongue is touching, that is the what? That is the hard palate, because it's hard. And now, if you look into the mirror and open your mouth, you find some kind of structure dangling downward. And Yoruba will call it belly. So the point is that that structure is soft. So therefore, it is called the soft palate. So the one right here that is hard is called the what? The hard palate. And the one right here dangling down is called the what? The soft palate. And anatomically, you can also call it uvula. If what? Uvula. And now, that is below the what? Inferiorly to the nasal cavity. We have those 2 structures. So you can write the palate, the hard palate, the hard what? The hard palate and the what? And the soft palate. And if you like, you can change it. Look at the structure. What is its relation to the mouth? It is the roof of the mouth. Because this will be the mouth, and then this will be the roof of the mouth. How do you get that? So the roof of the mouth is serving as a floor for the what? For the nasal cavity. As simple as that. Now, anteriorly, what can you see now? If you say anteriorly, it means in front. And this will be my front, and this will be my back. Now look at this diagram. Where is the front and where is the back? This will be the person's front. So in front of this nasal cavity, you have something in front, and that is the nose. So anteriorly will be the nose. As simple as that. And now about posteriorly at the back, what can you see? At the back right here, what you have is this pharynx. But at this juncture, at this junction rather, we have a structure there called the pharyngeal tonsils. Pharyngeal what? Pharyngeal tonsils. So you can also use that one as a structure in relation. So you can use the what? You can use the pharynx, and the what? And the pharyngeal tonsils. And the pharyngeal tonsils. As simple as that. And laterally, you can strike it out. If you want something, just write the conchi. So the conchi. I will tell you about that later. Now, I can still do it right here. Okay? So that is the structure in relation to the what? To the nasal cavity. And now let me quickly dish something out. And that thing is that you see that I have three lines here. One is on top. So let me come in with a new diagram so you understand this very well. So that is all about the what? About the nose and nasal cavity. I'm going to add more to it in the next scene. So the point is that the nose is made up of two parts, the external and the internal. So the external nose is made up of hyaline cartilage called the nasal cartilage. And the internal is made up of what? Of bones called the what? Ethmoid and gumma bone. And after that, for the organ regulation, structural regulation rather. So superiorly, we have the ethmoid and the what? And the sphenoid bone, which forms the what? Which forms the base of the skull. And after that, inferiorly, we have these hard palate and the soft palate. And the next thing is what? Posteriorly. So, okay, anteriorly. Anteriorly, we have the nose. And posteriorly, we have the what? We have the pharynx and the pharyngeal tonsils. As simple as that. For those of us that followed my class on lymphatic system, the last class we held, and that is what? That is on the lymphatic system. We talked about the tonsils there, under the mouth, mucosa associated lymphoid tissue. That's the female mouth. So we said we have tonsils and what? And Peyer's patches. So the function of this pharyngeal tonsils is to do what? So to detoxify. So the what? The hair we breathe in. So as simple as that. So to detoxify the pathogens with the air, rather. As simple as that. So that's just a recap or revision for that. So let me click on the board and proceed with the nasal cavity. I'll be right back. Yeah, welcome back. Now, let's quickly come in with the diagram of the respiratory system once again. Now, you have your words, you have your nose trees, and you have your nose rather. So, and then the mouth. And after then, you have the hard palate and the soft palate. So you can use it to draw your words, to draw your nasal cavity. Small indentation. Your pharynx too. Simple as that. Then you can cover it up. Now, here we have three things. And that was where we were. Now, the point is that these three structures here, they are denoting something. So within the wall of the nose, we have some structure called conchi. What? Conchi. That is for plural. Concha for singular. So we have three there. The upper one, the most superior one. So the strength of fundamental, what will this be? It's going to be superior conchi. As simple as that. From your knowledge of anatomical terms. So superior what? Superior conchi. And now, the lowest one right here, we call the what? It's going to be called the inferior conchi. So and the middle one is here, and it's going to be called the what? The medial conchi. As simple as that. So the medial conchi. So what is their function? Collectively, their function is to increase the surface area for air. Increase the what? So to increase the surface area for inspired air. So the air you are breathing in. So they are going to increase the surface area for it. As simple as that. And that's their function. And now the next thing I'd like to tell you are the paranasal sinuses. The what? The paranasal sinuses. Now what is the meaning of that? The word para is said to mean around, although it has other meanings too. Now the word nasal denotes the what? The nose. And the word sinuses means spaces or cavities. As simple as that. And now, paranasal sinuses from here, we mean the spaces around the nose. As simple as that. So paranasal sinuses, they are the what? They are the air-filled cavity. So they contain air. So they are the air-filled what? Spaces or air-filled cavities surrounding the what? Surrounding the nose. As simple as that. And now we have majorly four types of what? Of sinuses. So their acronym is FEMS, or you use FEM. So the F is frontal sinus. So the frontal sinuses. So the E is ethmoidal sinuses. So ethmoidal sinuses. So the next one is maxillary sinus, or maxillary sinuses. So and the last one is sphenoidal sinus. Now, if you take a look at this, you realize that all these guys, they are bones of the skull. So go check your video back on the body cavity. So you don't know that. So the point is frontal bone. It has the frontal sinus. Ethmoid bone now. So it has the ethmoidal sinus. The maxillary sinus is from what? It's from the maxillary bone. And next one is what? It's from the sphenoid bone. Simple as that. And now what is the function of all these guys? So the function of sinuses. So we have majorly two functions. The first one is that they lighten the weight of the skull. Lighten the weight of the what? Of the skull. And what's the meaning of that? Let's assume that we have this marker and we weigh it on a weighing scale and we get 200 kilograms, for example. And now I started drilling it, forming holes into it, and then clearing off all the particles. So and I drilled it a lot. So after drilling, I measured it again. Tell me, what is it going to give me? It's going to give me above 200 or below 200. It's going to be below 200 because I've drilled it and I've removed some particles from it. So because the sinuses, they're like holes like that in the skull, they lighten the weight of the skull. As simple as that. And now the second function is what? They serve as a resonating chamber for sound or for voice. Resonating what? Resonating chamber for sound. So as simple as that. And that will be the end for what? For the nose and the nasal cavity. So the next thing I'll be teaching you is the physiology of smelling. And then we call this class an end for today. So we proceed with the pharynx and the larynx in our next class. So we'll let me come back and talk about the physiology of smelling. I'll be right back. Yeah, welcome back. Now, talking about the physiology of smelling. Physiology of smelling. Now, what is the meaning of that? The word physiology, dating back to the first topic we taught in this course. So if you attended my class on fundamentals of anatomy, we understand that the definition of physiology is what? How the body structure. How the what? How the body structures or structure performs their function. So that is the meaning of physiology. So physiology means what? How the body structure performs their function. And which body structure are we talking about here? The body structure we're talking about here is the nose. So what we want to look at is how the nose performs its what? Its function. And the major function of the nose is what? Is smelling. So one of the major functions, apart from what? Of breathing in air, is smelling. So that is what we want to study. Now, let me bring you this diagram one more time for this class. Now, for the physiology of smelling, let's assume that the smell, a sweet one, or an odor is within the environment. So the person's nose is going to do what? It's going to serve as a conducting zone. So it's going to what? It's going to allow the passage of that odor or smell into the what? Into the nasal cavity. I hope you are getting that. And within the nasal cavity, this conchi, they are going to what? They are going to increase the surface area of the what? Of that very odor or smell. And in that process, there is a structure right here. So at the roof of the nasal cavity, sorry, they have a plate there, and the plate is called the cribriform plate. The cribriform what? The cribriform plate. And we all know that the plate used to contain something, that is food. But here, they don't contain food. What they contain are bundle of nerves. Contain what? Nerves. And those nerves are called olfactory nerves. So olfactory nerve. Now, let me come back again. Whenever smell or odor is within the atmospheric air, so the nose is going to conduct it into the nasal cavity. And within the nasal cavity, the conchi are going to increase the surface area. And from there, the olfactory nerve inside the cribriform plate, being a nerve, do not forget from our knowledge of fundamentals, besides the function of nerve is to generate. Generate what? Generate. And transmit what? Exactly. And transmit impulse. So, this air, this inhaled air, so which is either a smell or odor, is it smell or an odor? The point is, when it reaches the nose, the conchi, they are going to increase the surface area. And in the process, the olfactory nerve will generate the impulse. So they're going to receive it. And after doing that, they perform their second function, which is transmit, which also means send. And now they will send it upward into the what structure now. They will send it straight up into the what? Into the brain. And now what will the brain do with that impulse? The brain is going to do just one thing, and that is interpretation of the what? Interpretation of the smell or odor. So the brain is going to interpret it to you that this is what we are perceiving. And that is the what? That is the physiology of smelling. A quick recap. We said the smell and odor within the atmosphere is going to pass through the nose into the nasal cavity. And within the nasal cavity, the conchi, they are going to increase the surface area of the air. And then the olfactory nerve inside the cribriform plate at the roof of the nasal cavity, they are going to do what? They are going to perform their malfunction as a nerve. So they generate the impulse and they send it to the what now? To the brain. And once they send it inside the brain is going to interpret the what? It's going to interpret the smell and tell you the exact smell that you are what? That you are perceiving. And that is the end of this class. So in our next class, we're talking about the pharynx and the larynx. Until then, I wish you all the best. Hi guys.